Nearly 80% of adults over the age of 60 experience recurring lower back pain. But here's the surprising part. Recent clinical findings suggest that in many cases, the pain is not caused by aging itself. It's caused by three silent changes happening inside the body: reduced spinal circulation, weakening stabilizing muscles, and gradual nerve compression. And what most people over 60 don't realize is that the wrong movements can actually make this worse, even when they seem gentle. But the right movements, done for just a few minutes each day, can restore blood flow, reduce inflammation, and relieve pressure on the spine. Today, we're going to walk through 3 daily movements that spine specialists increasingly recommend for adults over 60. These movements are simple, safe, and designed to restore mobility without stressing the joints. But before we look at them, there's something important you need to understand. Because most people are unknowingly doing the exact opposite of what their spine needs. Lower back pain after 60 rarely begins with an injury. In most cases, it develops slowly over years. Here's what spine specialists are now focusing on. As we age, the muscles that stabilize the spine begin to weaken. These include the multifidus muscles, the deep core muscles, and the gluteal stabilizers. At the same time, circulation to spinal discs decreases. This matters more than most people realize. The discs between your vertebrae rely on movement to absorb nutrients and maintain hydration. Without regular motion, those discs gradually become stiffer and thinner. That stiffness can lead to increased pressure on surrounding nerves, especially the sciatic nerve. But here's where it gets more serious. When stabilizing muscles weaken, the body compensates by tightening other muscles, particularly the hip flexors and lower back muscles. This creates a cycle of tension, compression, and inflammation. And over time, something very subtle begins to happen. The brain starts interpreting normal movement as painful or dangerous. But this is where most people go wrong. They respond by moving less. Unfortunately, less movement reduces blood flow even further, which accelerates stiffness and pain. The key is not aggressive exercise. The key is the right kind of movement. And the first one may surprise you. One of the most effective movements for reducing lower back pain is something called a pelvic tilt. It looks simple, but physiologically it does something extremely powerful. It reactivates the deep spinal stabilizers. Here's how it works. When the pelvis tilts slightly backward, it engages the abdominal muscles and decompresses the lumbar spine. This reduces pressure on the lumbar discs, particularly in the L4, L5, and L5-S1 regions, which are common pain points after 60. To perform it, lie on your back with your knees bent and feet flat on the floor. Gently tighten your abdominal muscles. Then, slowly tilt your pelvis so your lower back presses lightly into the floor. Hold this position for 5 seconds, then relax. Repeat this movement 10 times. It may seem subtle, but here's why it matters. This motion stimulates circulation around the spinal discs, allowing nutrients and oxygen to reach tissues that have been deprived of blood flow. And improved circulation helps reduce inflammation and stiffness. But if you ignore this step, here's what happens. The deeper, stabilizing muscles continue weakening, which forces the larger back muscles to compensate. And that often leads to chronic tension and recurring pain. This single movement helps reset that balance. But there's another problem most people over 60 face, and it comes from an unexpected place. Many cases of lower back pain are not actually caused by the back. They are caused by tight hips. What most people over 60 don't realize is that sitting, especially long hours of sitting, shortens the hip flexor muscles. These muscles attach directly to the lumbar spine. When they become tight, they pull the spine forward into an exaggerated curve. This increases compression on the lower vertebrae. Over time, it can contribute to disc degeneration and nerve irritation. But here's the important part. The second daily movement targets this exact problem. This gentle stretch helps release tension in the hip flexors and gluteal muscles. And when those muscles relax, the spine naturally returns to a healthier alignment. Here's how to perform it. Sit comfortably on a chair. Cross one ankle over the opposite knee. Keep your back straight. Then slowly lean forward until you feel a gentle stretch in the hip and glute area. Hold for 20 seconds. Then switch sides. Repeat 3 times per side. This movement does more than stretch muscles. It improves blood flow to the pelvis and lower spine, which can help reduce inflammatory chemicals that contribute to pain. But this is where many people make a critical mistake. They stretch once, feel temporary relief, and stop. What matters is daily consistency, because muscles adapt slowly after 60. But here's where things become even more important, because the third movement addresses something very few people consider. Spinal health is not just about muscles and joints, it's also about circulation. After age 60, blood vessels naturally become less elastic. This can reduce oxygen delivery to spinal tissues, and reduced oxygen slows tissue repair and recovery. Over time, this contributes to chronic inflammation and stiffness. But here's what most people over 60 don't realize. Certain slow movements can dramatically improve circulation to the spine, and that brings us to the third daily movement. Walking is one of the most powerful therapies for the aging spine, but it must be done correctly. Slow, controlled walking stimulates rhythmic spinal motion, which acts like a pump for the discs and surrounding tissues. This pumping effect helps distribute nutrients and fluids throughout the spine. Even 10 to 15 minutes of daily walking can improve spinal mobility and reduce stiffness. But posture is crucial. Keep your head aligned over your shoulders. Allow your arms to swing naturally. Take shorter, controlled steps rather than long strides. If you ignore posture while walking, here's what happens. The body leans forward, which increases pressure on the lower spine. But correct walking posture decompresses the lumbar region, allowing nerves more space. Over time, this can significantly reduce pain. But movement alone isn't the full solution, because the spine also depends on nutrition and recovery. Healthy spinal tissues require specific nutrients. 3 are particularly important after 60. Magnesium helps relax muscles and reduce spasms. Omega-3 fatty acids support anti-inflammatory processes. An adequate protein intake helps maintain muscle mass that stabilizes the spine. Hydration also plays a critical role. Spinal discs are composed largely of water. Even mild dehydration can reduce their cushioning ability. And finally, sleep. During deep sleep, the body releases growth hormone, which supports tissue repair. Without proper recovery, inflammation accumulates. But here's an important reminder. Persistent back pain can sometimes indicate conditions that require medical evaluation, such as spinal stenosis or nerve compression. If pain radiates down the leg, causes numbness, or worsens progressively, consulting a physician is essential. Lower back pain after 60 can feel frustrating. Many people begin to believe that discomfort is simply part of getting older. But modern spine research suggests something very different. The spine is remarkably adaptable, even later in life. With the right daily movements, improved circulation, and proper support, many people regain mobility they thought was permanently lost. The 3 movements we discussed today, the pelvic reset, the supported hip stretch, and gentle walking, work together to restore the natural mechanics of the spine. They improve blood flow, they reduce inflammation, and they reactivate the muscles designed to protect your back. Small daily actions can create profound long-term change. And if you found this information helpful, consider subscribing for more evidence-based health insights designed specifically for adults over 60. Because the goal isn't just to reduce pain. The goal is to protect your strength, mobility, and independence for years to come.